Dr. Balaga here. I have another terrific God Knowledge Doc podcast for physicians and advanced practice providers, including physician assistants and nurse practitioners. You should find this podcast very useful in your practice. My disclosures are I have a podcast called God Knowledge Doc. Many of the podcasts are on cardio-oncology, and I'm one of the editors for the International Cardio-Oncology Society Board Review Manual. This podcast is on protein kinase inhibitors, Ribociclib and Palbociclib, and the cardiotoxicity associated with them. I recently had a patient referred. She was a 78-year-old female who was referred for possible AV block and EKG. The patient is on Ribociclib for metastatic breast cancer. After going through her chart, I found she had been on Palbociclib for a month and 2 months of Ribociclib. I had another patient who had metastatic breast cancer and was referred to me because her LV strain was decreased, and she was referred because she was on HER2 therapy. But after reviewing her chart, she was also on Ribociclib for metastatic breast cancer. So I'd like to bring to your attention two recent reports. One from Canada, which reported development of cardiomyopathy after therapy with Ribociclib followed by Palbociclib. And another case report, which reported from Rome, which reported second-degree type 2 AV block requiring permanent cardiac pacing in patients on CD4, CD6 inhibitors. An excellent review by Vijay Rao, Dan Lenihan, Anna Barak, and others, which discussed the clinical approach to cardiovascular toxicity in JACC, June of 2021, discusses the effects of Ribociclib on QT prolongation. And as per FDA, the review recommends EKG at baseline and approximately day 14 of the first cycle, then at the beginning of the second cycle of Ribociclib. It then goes on to say that after 14 days, as clinically indicated in those at risk for QT prolongation. A recent AHA scientific statement on cardio-oncology drug interactions, authored by Beavers et al. And senior author is Dr. Susan Dent, discusses Ribociclib, which has been approved for hormone receptor positive HER2 negative breast cancer in combination with endocrine therapy, and has been associated with increased QTc prolongation. The US FDA approval was contingent on close cardiac monitoring with 12-lead EKGs before initiation of treatment, at the middle of the first cycle, day 15, and before the start of cycle 2. They also go on to say that Ribociclib should be taken in the morning to reduce the risk of QTc prolongation. The NIH database emphasizes the importance of monitoring serum electrolytes, including potassium, calcium, phosphorus, and magnesium, prior to initiation of therapy at the beginning of the first 6 cycles and as clinically indicated. Clearly, any abnormalities of these electrolytes need to be corrected. They recommend avoid using Ribociclib in patients who are at a significant risk of developing QT prolongation, including patients with long QT, uncontrolled or significant cardiac disease, including recent myocardial infarction, congestive heart failure, unstable angina, and bradyarrhythmias, and electrolyte abnormalities. They also recommend avoiding Ribociclib with drugs known to prolong QT interval and are strong CYP3A inhibitors, because these patients are more prone to prolongation of QTc interval. Again, it's not indicated with concomitant use of tamoxifen because the risk of increasing QTc. This is a recent European Society guideline on cardio-oncology developed in collaboration with the European Hematology Association and the European Society for Therapeutic Radiology and Oncology, hot off the press. In this guideline, led by Dr. Alexander Lyons from the Brompton, recommended QTc monitoring at baseline and 14 and 28 days in all patients with cancer receiving ribociclib. QTc monitoring is recommended in patients treated with ribociclib with any dose increase. Apart from cardiomyopathy, which Ks and the QTc prolongation and the AV block, the AHA scientific statement recommends that the use of ribociclib should be avoided with PGP inhibitors, including apixaban, rivaroxaban, and so it's kind of important to keep that because it increases substrate concentration. And finally, an article in JACC Cardio-Oncology described that protein kinase inhibitors increase, particularly ribociclib, increases the risk of atrial fibrillation. So this is in a nutshell what the cardiac manifestations of protein kinase inhibitors.